Good morning. Today is day 3 of 3, and today I'm charge nurse. I feel exhausted, yet excited. I feel hopeful. Today's going to be a good shift. I'm Justin Satori. I work as a charge nurse over here at the University Hospital on the surgical ICU. Typically, it's a lot of cancer patients. So a lot of chemo, they have already went through chemo or they're going through surgery to get their cancer taken out. So a lot of oncology.
Because then you can always pull over the stabilizer onto that iPad later on.
I have worked here, my 2 years is in January. Typically, us charge nurses just get here a little bit early in the day, typically around 6:30, 6:45 in the morning. And then the two charge nurses meet, night shift and day shift charge. We go through our patient population for that day, so then just our patient list, what all is going on for them. After that, I check all of our code cards. I make sure that they're stocked and that everything's where they need to be, just in case any emergency needs to happen. I check my line carts just to make sure that those are stocked okay and if they need to be stocked. And then after that, it's meeting with the doctors for huddle. For our surgical ICU, we always have our attending doctor. Our attending doctors rotate in and out. We'll go room to room to run by our plans and try and figure out how to help our patient for the day. After that, typically we'll do our interdisciplinary huddle where we get a resident in there, our chaplain, our social worker, our case manager, and sometimes our nutritionist or dietitian. A lot of the meetings for the surgical ICU all happen straight in the morning because towards the afternoon is whenever all of our surgeries come out from the OR, and that's when we start working on admission. So we'll start putting in the skeleton for all the charting, so I'm putting in all their lines, all their wounds that they have from the OR. We'll start putting in oxygenation stuff such as breathing tube, if they have one or not, or if they have a tracheostomy or a laryngectomy. That's when it becomes more bedside for us and more of a helping hands kind of role. Difference between being at charge and being at bedside, it's a lot more puzzle solving, trying to figure out more big picture rather than just focusing on your patients. Typically, I'm good at guessing what people need because I've been here for so long now. While I'm in charge, it's doing kind of like the back end of the work, getting all the tedious stuff that would make it harder for the bedside nurse to do. I always want to be that helping hand for people, for caregivers. We care a lot. We care a lot about our friends, our patients, and we want to make sure that everyone's doing okay. I can always step in and take over. If they need to step away just for like any emotional or physical ailment that's affecting them at that moment, go to our nurse sanctuary and just let it out and cry. It's just a little room that we have on the surgical ICU that just provides like a nice little safe space for us to go to if we just need to step away. It was a lot today. A lot of stuff at the very end. 2 admissions from the OR, 1 outside hospital that had to get lifelined in, and a rapid intubation. But we made it through. It was all good.